Today I wanted to talk about a little bit about antidepressants. This is in light of my 2-year landmark. Sorry, just had to switch on a light. My 2-year landmark of taking antipsychotics myself. Antipsychotics, also synonymously antidepressants and things like that, are just medication that you take for psychological issues, not physiological. Although the only way that you usually find out about being psychologically ill is your physiological habits, perhaps symptoms you have even that come along with it. Restlessness, for example, super physiological, but insomnia, physiological, but it actually points towards having psychological issues. So I'm someone who has 2 types. I don't care to divulge them for now. And recently this August has been, I get the landmark, the anniversary of 2 years being on my medicine. I take a few. It takes a while to find out 1, 2, or 3, or several that you'll need to take together to create the perfect concoction to help you with your psychological imbalances, to get you back on your feet. Today, I wanted to share how you get help when you suspect that you are mentally ill. You could think it's a disorder. You could think you're a little bit unbalanced. You're sometimes angry. You could have hallucinations. You could know that you're mentally ill. You could still be doing all of your occupation and tasks, which can sometimes be labeled as high functioning, but still have a lot of pain, a lot of discomfort and confusion alongside achieving things. That's how you know to yourself that something's not right. So I live in Malaysia, and I want to share how you get mental help if you suspect that you have it. You may be faced with rejections sometimes, so if you have someone or a group of people you truly trust, let them be there to support you. Because some doctors will say, you're not crying, or you're not being impulsively angry, I don't think you have trouble. But you have to press that I want to be seen and treated. So first, you go to a clinic. You can go to a private clinic, but if you go to a government clinic, then you only have to pay 1 ringgit. Great. You do have to wait. You go ahead and you come in, you are coming there to see the doctor. And when you see the doctor, you want to explain the things that you've perhaps also looked up on Google that you are definitely experiencing. Insomnia, rage bouts, crying every day, multiple times a day. Feeling so dark, like there's nothing bright, warm, happy, uplifting. You really don't feel there's anything like that. Or it's so little and it comes so rarely. You may feel like you'd rather be dead. You may feel like you'd wish you were never born. You probably have a lot of resentment towards a lot of things. You maybe have lost hope in happiness, contentment, in feeling safe and secure in being able to do something again. Because some people are not high functioning. Some people, when they become ill, they are also low functioning, because it doesn't change the fact that you're ill whether you can do more things or not. It's truly about what you feel and how you can think, about your perception of the world. If that one doesn't lighten, then you're still unwell. If it can lighten, if it's dark, even though you're able to do tasks and your occupation, school, jobs, caring for family members, but you still feel very dark in the mind, fogged, upset, angry, very often, or no happiness, no enjoyment, numb, then you're still unwell, even though you're able to do all the things expected of you and what you expect of yourself or what you'd like to achieve and fulfill. So first you head to a clinic. You can go to a private clinic. Usually the consultation fee is about 20 ringgit. Maybe you can go to 30 ringgit. Or you can go to a government clinic for 1 ringgit. You see a doctor. You explain your symptoms. Beforehand, if you can, write them down a list and go ahead and just glance in Google. What is this connected to? And what you feel strongly about. If you really do strongly feel you're depressed, you're anxious, you keep needing to take a dump. And number 2, a poop before class every time. Before you leave the house every time. That means you're so anxious that your bowel movement pushes everything out. You notice it and it makes you uncomfortable. You have hypohidrosis. You're sweating, 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 sweating. When you're anxious, or maybe when you thought you were calm, but your heart's beating a little fast and now you're sweaty in all the spots. You go ahead and you tell the doctor this, and you ask for a referral letter to be seen by clinic pakar or specialist doctor from the psychiatry department in a government hospital. If you have money, you can use this referral and go to a private hospital. You can also go to a private hospital's psychiatry department straight away, like no need for a clinical reference. But a clinical reference helps. It helps make things faster because doctors and nurses will always, and the administration of you as a patient, anywhere, is just like straight to the point of treating what you're very sure you have. If you have a referral letter, if you're able to get one, it also confirms what you think you have. It's the first confirmation, and the second confirmation will come from the doctor that will be treating you from the department that you specifically need to be heading to. My kitty cat. So you get that referral letter from a clinic. But if it's private, you usually can just go straight without a referral letter. You want to go to the psychiatry department. It can be the psychiatric counseling department, psychiatry and psychology department. It needs to be where there's psychiatrists and psychologists, but mainly psychiatrists, because psychiatrists are the ones who will. They will go ahead and assess your symptoms that you say, and over time, they may not give you treatment of medication straight away. They may need to see you at least 2 times with you showing the same unbalances, with you claiming the same symptoms before at least 2 times, which is usually in between is 2 weeks or 1 month if it's government. It can be very short and intensive if it's private, or if you're a severe case, you also get short and intense periods of appointments. You don't get to wait so long. Camera's falling. Alrighty, hope it doesn't fall. Okay. So, be patient. Follow what the doctor says. Make note of the doctors that make you feel very bad. Multiple times seeing them, you'll know what doctors are good, what doctors are bad. And I mean bad doctors. I mean there's really just 1 or 2 that make you feel so crummy. So you may want to have your family members with you. So don't go without them. Second, my camera is acting up. Camera is acting up. Alrighty. Okay, that should be good. I hope it doesn't fall. I think it might fall. Darn, I think it's about to fall. Alright, fixed my camera. Alright, you got the referral, the clinical referral. You get yourself an appointment at the psychiatry department. You may have to see them 1-2 times before they prescribe you any medication. Only a psychiatrist will give you medication. A psychologist will only see your symptoms and give you psychotherapy, which is talking therapy of different types, to try and help you fix the severe or the mounted up distorted thinking that has caused you to become so unwell mentally. Yes, your thoughts are a huge part of it, and over the line, there will be any counseling of talking is to try and help you correct your mindset alongside, if you need, medication to help you with hormonal imbalances or you're missing brain chemicals that are causing you to feel the way you feel. So you'll be needing maybe both or one or a mixture. You'll see how much you'll need when the doctors prescribe to you. If you feel you're very severe or you're having no help from the lower doctors, they're called MOs, medical officers. They are both psychologists and psychiatrists. Usually they're psychiatrists because they will also be prescribing you medication under the advice of the head of the department, which is usually a specialist, a psychiatric specialist. If you feel you are severe and not light and your symptoms are perhaps wrecking a lot of things, you can't wait, or there's a lot of things riding on this, you can go ahead and request to be seen by the specialist. Ask if there's a slot in the specialist and you can follow up under the specialist. You may or may not get, because they will do their best to assess whether or not you, compared to the other patients that are all also going there to attend to get help, they have to rank the ones that definitely require the direct follow-up of the specialist. If there usually there's only one. If you have more than one in the government hospital, that's awesome. Or if you'll be delegated to the MOs, which are many of them, and none of them are specialists. But they can still greatly help you. They will increase your medication, decrease your medication, give you some counseling. There's also a counseling department, usually at the government hospital, which is only talking. They'll give you solely, it's usually a psychologist alone. You can be a specialist psychologist, but still a psychologist. She will not give you any prescription, or he or she will not give you any prescription. So there you are. You will be inside the database and be given appointments. Attend all appointments. 1 week from now, 2 weeks from now, a month from now, 2 months from now. The longest they usually give you is 2 months from now. You usually will be doing very well, or they have very low resources. That's the only reason why they put you so far. And if anything happens, you feel terrible, you feel collapsing, crumbling, on the verge of something very serious, like self-harm. There's many ways you can harm yourself. Just putting yourself in reckless situations is also self-harm. Suicide, thinking that you want to die more and more and more, feeling a suicidal ideation, feeling like you're very triggered by things often and you're constantly in like almost like a vegetable state of just shock. You're constantly being triggered by things. You may be in a very traumatic state of shock and you actually need to be brought out of it with medication and probably psychotherapy talking. Suicidal ideation is when you plan. You plan on how you should pass away. You plan on how you should die, soon or later. You're planning on how you should. That's not a good thing. Not contemplating on how you could pass in your experience of your life, but actually planning on how you can make it happen. So anyway, by accident, by carelessness, recklessness, on purpose, direct or indirect action is planning, and it's ideation that is not right. It's bad. Is my thing falling again? That's not. It's bad. Red flag. You want to go and tell the doctor. If you didn't mention it last time and it was just yesterday you told them, and now the next day you're feeling so bad, go again. Just show your face and go again. Go again. Register your card however they tell you to, your appointment card. Wait in line. See an MO with a specialist. Whoever will see you. And be persistent about what you're feeling. If it is bothering you and you're like, no, this is going down a road I don't want. I want to be healthy, stable. I want to be able to be focused, to see things clearly. I want to be happy. I want to be in pleasure and happiness and contentment, not anything the opposite. It's been so dark. I don't want it to get any darker. Or you can see yourself going low in any way. Yeah, you can go again. Show your face. And you will get better. Every time you follow up the appointments, you are getting better every day, and every time you continue the treatment that is provided to you, you will get better. You will get better. If you stay around, if you keep up the appointments, try and have a support group, support family member, friend. for the healthy routines at home, to make sure you can attend on time and everything like that. And, you know, the dark episodes that happen regardless of being on or off medication, using the methods in psychotherapy, you can still go through dark episodes, very high stress episodes. They really are episodes. They happen, they start, they stop. They start, they stop. It is quite difficult, but you can get through it. And just like how it started, it can end. Just how it began and it got worse, it will lessen and it will end. You just got to follow this treatment plan that the doctors will let you know. Be as patient as you can, because if it's government hospital, they're quite slow. But you will get the help you need. The right medication, you will. But they have to find out what medication works with you. They have to find out from your own body giving side effects or symptoms, relapses, or anything like that. If they take away something, you may get a withdrawal. You'll figure it out with the doctors. It's so much better to go and get help. And if you need to do it on your own, do it on your own. But do it rather than not. You'll feel better knowing that you're taking care of yourself. Imagine yourself as if you were somebody's child and the parents loved this child. They see all the symptoms that you've been experiencing. Imagine those parents, if you don't have good parents around, let's say. If you do have good parents around, may they be supportive of you. Imagine yourself as that child of two parents who love you. They want you to, they see you going through these symptoms, they note it because they're doting parents. And imagine this, and you're that child. They see you go through the things you go through and they need to get you help. That's like one analogy that can help people get themselves the help they need by caring for themselves as if they were their own parents, as if they were their own friend or brother or sister that loves them, that's seen the pain they go through and knows that they need treatment, they deserve it, they deserve to be happier and healthier and safer. I hope that this just 17-minute video was a bit long. I hope that it can help someone out there know what to expect in Malaysia of getting mental help. If you need to speak Chinese, Tamil, English, Malay, you can always ask. You can always ask. And be prepared to ask again and again. Can I have an English speaker? Can I have a Malay speaker? Just keep asking. They will try their best to accommodate you, as long as you always ask the questions. Allow yourself to be ready to ask again. You need stuff. You need certain accommodations. You deserve those accommodations. So I hope... Okay, my cats are doing their nightly zoomies. Yes, it's nighttime. After watching a scary movie, I went ahead and decided to share my experience to help some people in Malaysia seek the help they need. Because I would have loved to have seen a video like this years ago. You can be any age. By the way, you can be any age and go and get help. You can be underage without anyone. If you explain your situation and you say you need help because you don't want to hurt yourself, because you want to be safe from your own symptoms. All right, I'm going to wrap it up here. It's just under 20 minutes. I hope this helps you either understand someone else's point of view or what all those patients sitting at the psychiatry department chairs, what are they going through? What are they expecting? They could be new, old. I hope this helps you in any way that it can. I really hope it helps at least one person get help or get help in a better way here in the country of Malaysia. All right. Bye-bye. Have a great day, week.